There's no question that the COVID-19 pandemic has had a terrible effect on the world's most vulnerable. The continent's children are among the most at risk. Unicef has released a report looking at the indirect effects of the pandemic on the continent's children. People have been reluctant to seek health care, leading to serious consequences. There have also been disruptions in accessing immunizations, neonatal care, as well as treatment for HIV and AIDS. Education came to a halt, and many children did not have access to online learning facilities. Malnutrition has become an even bigger threat as parents lost their jobs because of the pandemic. Let's talk now to UNICEF Senior Spokesperson James Elder. He's joining us via Zoom here on the Midday View from Nairobi, that's in Kenya. Mr. Elder, good afternoon. Welcome to the Midday View on ENC. Not a pretty picture indeed when you look at the holistic impact of the pandemic on children on our continent.
No, a very dire picture at a time when so many countries were doing so well. Education rates were up, quality was up, immunisation rates were up. And despite the fact that young people are clearly so less affected by this pandemic than older, we nonetheless, because of implications, because of a lack of vaccines, because even before the vaccine of things like lockdowns, although needed in some areas, obviously other areas they were excessive, school closures and so on, then we do have, crazy numbers of children out of school, as you say, mums unable to access health facilities. Numbers like 50 million more people have fallen into severe poverty in the last year. Now, things can be done around this, but yes, just as the pandemic's touched every part of the world, yet again, the most vulnerable have been impacted the most severely.
Now, this is likely to have a lasting impact on children, and measures are going to have to be taken urgently and speedily to try and address those and regain some of the progress that was made before the coronavirus pandemic.
Spot on. And UNICEF keeps saying and keeps advocating, and we keep programming, we show these things work. There's a couple of key things. One is, do whatever you can when a pandemic is spiking, but try as best and do not close schools. Keep children in the classrooms unless it's an absolute last resort. When they're not in the classrooms, violence spikes, teen pregnancy spikes. That's a problem we'll have way after COVID. And of course, children will not be educated and will not become that great economic source for their communities. So we know keeping kids in school, we know the economic value of education, and we also know the science in terms of how children are not super spreaders. But as governments cope with all the challenges that are going on, we also know, as UNICEF, that we talk to governments in the continent and then the big donors, Europeans, the Americans, DFID, about cash transfers. Unprecedented problems need unprecedented solutions, and getting cash into the hands of the poorest people has a flow-on effect, has an incredible impact, and that's what needs to be done when you've had tens of millions of people fall into poverty. So we do have the solutions at hand, just as the COVAX facility in terms of getting vaccines equitably to people is a solution. It requires political will, it requires money. But at a time when the continent is going through such a population boom, you cannot afford to have this as a lost generation.
Yeah. Now, finally, sadly, you look at conflict, it's still an impact despite COVID-19 or in addition to COVID-19. Look at what's happening in northern Mozambique, for example. The children there have also been badly affected, and there's conflict in different parts of Africa.
Yeah, it hasn't waned. As you say, Ethiopia, Tigray, we weren't expecting that 4 or 5 months ago. Cabo Delgado, what's been happening to children and to civilians in general has been horrific. There's still conflict. There's still been, there's been killings of children in Niger. UNICEF time and again makes pleas around international humanitarian law. We have people on the ground, we monitor and so on, but at the end of the day, this comes back first and foremost to ensuring that, governments protect those civilians. It's unspeakable to think that in 2021, when we are dealing with so many challenges, and when children are facing the brunt of a climate crisis or COVID, they've also got conflict around the corner. Now, those things obviously are difficult to solve, but we know how to do that. We know how to be in the front line. We know how to get emergency support to children and so on. But as you rightly point out, first and foremost, we need those actors, government actors and non-state actors, to put the population's interest first and foremost, and find a solution that is peaceful and allows communities to go on, which is what they're trying to do, go on and looking after one another in a peaceful environment.
James Elder, as usual, thank you very much for your views and for joining us here on the Midday View on ANC. He speaks on behalf of UNICEF. He was talking to us live from Nairobi in Kenya.